proud member of Wisconsin Federation of Nurses and Health Professionals, Local 5001 in Milwaukee. I'm a surgical tech at the city's only unionized facility, St. Francis, and I'm a single mom of 3. My daughter's 18, my daughter's 16, and I have a 6-year-old son. I stand here as a person with employee-provided benefits. I used to work in retail. 6 years ago, I made the move to healthcare. And at that 6 years ago, I had a $0 deductible. Today, I stand before you, and I have to pay $2,500 deductible a year as a single mom. And I'm not a nurse. I'm part of the health professionals, and I make less than $20 an hour. So if you think about it, I don't have a large income. My co-pays are outrageous, and I have to plan ahead to decide what bill I won't pay when it's time to take my kids to just a general appointment, because I have to put out $75 once all 3 go in to make sure they get their health checkup. Let alone do I fear my 6-year-old riding his bike outside after school and breaking his arm, and me going for an emergency room visit, which will cost me over $100 just to go through the doors. John McCain's plan will tax that dollar that I already live check to check on. So how do I make it past my check to check now, and there's going to be more and more taxes on top of what I pay? What will I do? But the real question is, what will the people do that come into my facility without insurance? I had a 24-year-old girl who came in, no insurance, she's still going to school, had to have an emergency appendicitis, came in through the ER, came onto our floor, and had to see a financial counselor. She works some small job because she's in school, has to plan out how she's going to pay this bill now, and the reality is she really even going to be able to make those payments? The other day, I'm a surgical tech in OB, like it was said. We had an 18-year-old girl who came into the hospital and said she didn't know she was pregnant, and ended up having an emergency C-section, delivering a 32-week infant that will spend the next 6 to 8 weeks in the neonatal intensive care unit at our hospital. And how do we pay for that now? How does she pay for that? How does her family help her pay for that? St. Francis, where I work, was able to help her with small things like clothing and formula. But the reality is, what will those charges in the intensive care cost this family, let alone the possibility of us as taxpayers paying it? More and more people are entering our facilities without insurance. Financial counselors come to visit them, but the reality is, as they set up those payments, they didn't have money for insurance. How are they going to afford to pay those payments? So I think we all need to think about it. McCain's new health care scheme will tax not only my minimal income, but all of our incomes. The result is I and you will pay more and more for less and less. That's McCain's answer to our health care crisis. McCain wants us to strip away any regulation left. The free market certainly didn't work for our economy, and it sure won't work for health care. Just say no to Senator